Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to connect a patient to an ECG and then printing that out and interpreting it for veterinary nursing care fall semester 2024. So when you are going to hook a patient up to an ECG, you ideally want them in right lateral as still as possible, on a blanket or a towel, not on a metal table because that can cause artifacts in the reading. Making sure that they're warm and comfortable because the shaking and trembling can also cause artifacts. When you're reading this, typically you'll want to read off the second lead. So not all of the leads are marked with where they go. So if you pick them up and you have a color and you're not sure, typically there's black ink on white paper, and white is right and black is left, and you put red ornaments on a green Christmas tree. So red would be the left hind limb, green would be the right hind limb. With that, for the front legs, you're going to place them proximal to the olecranon and caudal. So right behind that elbow, and then for the hind limbs, you're going to place them proximal to the stifle cranially. So we have alcohol that we're going to be using. You can use this or electrode gel depending on what you have. And you're just going to damp a small area. If he were a thick coated dog, like a husky or a shepherd, you would want to shave areas to get the most accurate read. So I'm just going to put a little bit here. It's just cold. Okay. Okay. Okay, so the other way people will remember this is you always see smoke before fire, or it snows on grass. I'm going to print out the ECG now that he's been laying really still and come back and read that. Okay, so I have two printouts here of Miller's ECG, and both of which are pretty similar. One's got a heart rate of 119 and the other one of 123. You typically do want to read off of lead 2. There is a lot of artifact on lead 2, probably considering he did have to have somebody restrain him to obtain this ECG. He did get trazodone, but that was not enough to make him want to lay still. So what I'm seeing here is a normal sinus arrhythmia. So identifying our complexes are a bit nicer on that first lead. Like I said, lots of artifact there with the second. Similar, but cleaner with the first lead. So starting out, we have this little hump there. That is our P wave. When we div it down, that is our Q wave. Coming up to the top, R. And then when it comes back to go flat here, that is our S, and then T. And it's nice and evenly spaced. It's consistent. There's no big drop-offs that would tell me that, you know, his heart's not contracting. At the where your P wave is to the time it drops to your Q is your PR interval. So right until it starts to drop. From your Q to your T, that's your QT interval. So you want to look at spacing. You want to look for any abnormalities thrown in there. But it all looks pretty consistent. Matching a sinus arrhythmia, which is normal in dogs. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to give a dog sub-Q fluids for veterinary nursing care fall semester 2024. So things that you will need are your gloves, you will need some gauze squares, your bag of fluids already primed and ready to go, and then fresh needles. So what I'm gonna do is you first wanna know where your fluid bag is left at. So this has been left at the 6. If I'm giving him 100 mils, I need to make sure that I stop at the 7. So you just want to know where you're starting and ending. So I don't know that this is a new needle, so unless I didn't put it on myself, I don't trust it. So take that off. I'm going to put this needle on the hub there. So where you would check skin turgor is where you're going to poke. So with my left hand here, I'm going to pull up on his skin. I want the bevel side up, which is the pole of the needle. And where I would check skin turgor, I want to make a little indent with my finger here, and that's where I'm going to poke. So, poke. Now I'm going to unclamp it. And as this fluid bubble starts to fill up, you want to massage the area so it's more comfortable for the patient. Stretching that skin can be very uncomfortable. Typically, if they were getting a large volume of subcu fluids, the recommendation is that you only do 10 to 20 mils per kg in that site. So sometimes they'll require multiple locations. Now that he's finished, I'm going to pull out, pinch the skin. I've already clamped my line, I cap that. I'm going to use some gauze squares and just massage over the area that I poked until we get a decent amount of clotting. Hi, my name is Faith Jordan. Student ID is 3630837, and today we'll be demonstrating and explaining proper disinfection of a cage for veterinary nursing care fall semester 2024. So here we use these little card indicators that say clean and then dirty, sprayed, at. So at the at, we write the time that we've sprayed it. We use ProVet here. The contact time for that is 10 minutes. So we write the time that it was sprayed so that in 10 minutes we can come back with a damp cloth and wipe it out. So typically what I'm gonna do first, if there was bedding in here from a previous animal, cat, they can make messes. So I've got like a wrapper here, I've got some hair. Any big debris I'm gonna want to move out first. So that would be like dried blood, feces, urine or litter that's caked on there. You want to get that out there so you have a fairly smooth surface to work with. After that, I'm going to spray. I'm going to spray the top and the back, the sides, and the bottom. Close the cage. And then I'll write what time it was sprayed at and then come back in 10 minutes after that sitting time so I can wipe it out. So now that it's been 10 minutes and it's sat, I'm gonna work my way through the cage, wiping all the sides. So that's the front of the door, the back of the door, and top, bottom, back, both sides. I like to move from the top, which would be the cleanest surface, to doing the sides towards the back, bringing the back down and pulling out. So working cleanest to dirtiest. And I've got my damp rag here. And I'm kind of just gonna do it sweeping motion like that. Make sure I get all that area. So now that I'm at the back, I'm gonna start in this back corner and come towards me. If there's any blood, I wanna be sure, or anything that's caked on here, I wanna be sure to get that off for the next patient. And then if I have any debris, typically I like to anyway, just fold the washcloth in half. And then I'm gonna come on this side and doing the same thing. So starting the back corner, pulling forward. Okay, so now that I've done that, I'm gonna wipe down the back of the cage. In that sweeping motion, try not to pick up my washcloth. Okay, and then I like to open it up and use a completely different side and go through it again. And then now that I'm at the bottom, I'm going to do that same motion, but towards me, so back and forth. The idea is to get whatever residue you have in here coming out at once. Okay, Okay, yeah, so I got a lot of hair out at that time. I'm gonna fold it in, I'm gonna go through it one more time. Okay, so now I'm gonna use the clean side and wipe down the grates here. If there were any blood, vomit, feces, urine, again, we would want to remove those off the grates. So now that I have cleaned and disinfected everything, the whole purpose of letting it sit is to rid the cage of any leftover microorganisms, to try and kill those off. So it's disinfected, but now this cage is clean and it's ready for the next patient. My name is Faith Jordan. Student ID is 3630837. And today I will be demonstrating how to pill a dog and explaining that process for veterinary nursing care fall semester 2024. So again, I've got Miller here. I don't have any pills to give him, so I'm going to use a piece of food. I've got that, and then 5 mLs of just normal water to follow that with. So what I'm gonna do is, come here, pill or food between your thumb and index finger here. And what you're gonna do is hold that, I use my dominant hand. Your non-dominant hand, you're going to hold up at the lip folds to pull the head towards you. Otherwise, if you're holding the head, you wanna do it in front of these zygomatic arches. And then once the mouth is open, because you'll use your middle finger here and your these 3 fingers or 2 to pull down that bottom and place this in the back of the mouth, on the tongue, at the back of the tongue. So holding up, placing at the back of the tongue, dropping the head just a little, and here's some water to follow. Just offering a little bit of water to make them swallow and encourage that material to move down. The reason why we do that is because sometimes those pills, even though they are swallowing them, they're getting stuck in the esophagus. And by doing that, it creates buildup, it can create secondary infection, and they're really not getting the pills because they're not dissolving into their system. So it can be dangerous to do that. With the water following in the syringe, you want to be extra careful that they don't aspirate it and that you're not forcing it down them. So give it to them slowly, let them take their time, and that's how you pill a dog. Hello, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating and explaining how to pill, administer oral medications that would be a pill capsule to a cat. I've got Fredonia here. She is here with me for demonstration. She does need an annual lab work done, and she is actually pretty fearful at the vet. So I am not afraid to admit she is one that does require some chill protocol. So what I've got here is her gabapentin capsule. Let's see if you can see that. And then I've got about 3 cc's of water here. The reason being, we don't want pills or capsules, tablets, things like that to get stuck in the esophagus. Even though they appear that they're swallowing, it could be stuck further down. And what that can do is, if they're on a regular medication or certain medications, that can build up. Some medications can cause erosion to the esophagus, so breaking down those cells, creating secondary problems. If so much of it builds up, it could even cause potential for aspirating those things, or creating a secondary infection with that buildup. So we want to give them water just to make sure that they are actually swallowing and to help move those contents down. So 2 different ways that you can do this. You can hold with their upper lips with your non-dominant, I use my non-dominant hand while holding their head up. I always tell owners it is easier when your cat is at like waist level surface to back them up into you, because naturally they are going to want to back up while you do this, and so they can't really go anywhere. The other thing, you can hold in front of the zygomatic arches here and tilt the head back. When we are giving the water though, we do want to drop the head just a little bit. It's harder for them to swallow with their head completely extended, with that neck extended. So I'm going to take the pill and put it between my index finger and thumb here. I am going to hold her upper lips here. With this middle finger, I'm going to part her lips, and I'm going to drop it right there. Yeah, good girl. And now I'm going to give her some water. I know. Is that nummy? And then the second thing that I have here that I do like to use with cats, secondary to pills, is a reward or treat. So I've got Churu here, and typically she does like that as her reward. And that will also help, because it is a liquid, will help encourage moving any contents that could potentially be stuck in that esophagus. And also it's a little treat saying she did well for this. So that is how you would pill a cat.